I see no hands. And is there anyone here for public comment? This is a very small and quiet group. It's almost
Sean,
like we're having a meeting on a
then.
Monday morning. Oh, Dan Klein, there you are. Yeah. Hello, Dan.
Hi, I just
want
to
Dan,
mention.
You're on mute.
Can you hear me? Okay. I just want to mention that this meeting was scheduled at a not normal time. I have a meeting at 3 o'clock, so I'm going to need to step out a little early if we're still going.
Hello?
Shauna, can you not hear me?
I just figured out that I had my computer on mute. That's awesome. It was my fault. No wonder it was so quiet. Okay, enough of that silliness. Sorry, Dan, go for it.
I just said that because this meeting is not at its regular time, I have a meeting at 3 o'clock. So if we're still going by then, I'm going to need to step out a little early.
Okay, so why don't we make some changes to the agenda so that we move up all of our voting issues to the front end of it. And we will move the committee goals a little bit further down. Let's go ahead and start with the Youth Services Department, the resolution for the budget adjustment. If I could have a mover for resolution budget adjustment, Tompkins County Youth Services Department, ID 9879, moved by Amanda Champion, seconded by Dan. And Kate, can you tell us a little bit about this budget adjustment?
Yeah, so this is just, we got, at the beginning of January, we got some influx of state aid from the state that was to be spent in 2020, even though we were in 2021. And so this is a budget adjustment to allow us to move some funds around to cover the cost of 2020 expenses for some of our agencies.
Great. Are there any questions? Okay, let's vote via roll call. Dan Klein?
Yes.
Amanda Champion?
Yes.
Henry Grandison?
Yes.
And I am a yes as well. That is a 4-0 vote. Thank you very much. Let's move on to our, let's see here, our advisory board appointments. And we have a few here. If I could have, I'll do the announcement first for the Personal Emergency Response Services Advisory Board, Amanda Champion. For the Human Rights Commission, Josephine Karsich, Amos Malone, and Jesse Mansilla. For the Substance Abuse Subcommittee, Penny Cranen. And for the Mental Health Subcommittee, Edward Bergman. If I could have a mover for those, please. Moved by Dan, seconded by Amanda. And are there any questions or comments about those applicants? I see none. Let's do a roll call. Dan Klein?
Yes.
Amanda Champion?
Yes.
Henry Grandison?
Yes.
And I am a yes as well. Congratulations to all of those new and some renewed advisory board members. Thank you. Next, and this is just a discussion item, is the assignment for the liaison appointments for the Health and Human Services Committee. To the Alcohol and Drug Council of Tompkins County, Henry Grandison, 2021 liaison. For the Community Mental Health Services Board, I will be appointed to that, and Henry Grandison will be the alternate. Once our new legislator starts on that, they will be the alternate. For the Health Planning Council, Amanda Champion. For the Homeless and Housing Task Force, I will be the delegate, and Henry Grandison will be the alternate. For the Office for the Aging Advisory Committee, Amanda Champion. The Senior Citizens Council and Lifelong, Dan Klein. Tompkins County Youth Services Board, Glenn Morey. Human Rights Commission, that is going to be filled by our newly elected legislator, should start around March of 2021. The Human Services Coalition will be filled by Martha Robertson. So thank you, legislators, for volunteering for those roles. They're very important. Are there any questions? Okay. I am actually going to combine our chair's report with the conversation that we are going to have around 2021 goals, because I think we're going to be at it for a while. And I know that Dan has a meeting at 3, so we're going to try and speed things up a bit so he can be part of the conversation. The county administrator is currently working on the Reimagine Public Safety and Law Enforcement report right now, so he will not be joining us. Frank and Amy have actually been called away to an emergency that they're dealing with right now. So they also will not be at our meeting this afternoon. As always, if you have any questions, feel free to email them or text them or give them a phone call. Let's move on to our 2021 committee goals. And Henry and I did meet with all of our department heads just to go over what their plans were for the upcoming year. And we made a very broad outline of some of the goals that we thought might be important for our committee. This isn't to say that they're set in stone. We just wanted to set forth some ideas. And so I am happy to read those, and we can actually go department by department. And I would love to hear some feedback from the department head if they're here, and then legislators, if we would like to tweak these, if we would like to add or take away. I am absolutely open for comment, and I want this to be a very collaborative effort. So let's start with the Office of Aging. Provide outreach to the senior population and communication for testing and vaccination options. Continue to assist seniors in our area to navigate through the process. And Lisa Monroe, you're here with us today. Would you like to add anything to those goals?
No, that sounds pretty on it and what we've been trying to do and what we see ourselves doing in the near future. So I think it's pretty right on.
Okay, great. And I actually attended the Center for Excellence, the age-friendly training this morning. It was very well done, extremely wonderfully organized. Your speakers were great. She had speakers from the state coming, and it was a great discussion on how to make our community age-friendly. This is one of a few workshops that they're doing, so I'm sure Lisa will send us more information as the workshops occur. I would definitely encourage anyone on the committee and any legislator or community member to watch the meetings, because they were very informative.
Yeah, it was recorded, so it will be on the YouTube page.
Okay, that's great. Are there any questions for Lisa, or would anyone like to add some goals or ideas for their 2021 goal? Dan Klein.
Yeah, in 2020, we had the home health aid crisis on our goals. And for obvious reasons, we weren't able to follow through with that. And it's very possible that there's not going to be space in 2021 either. But I'm wondering if we could just put it on the list at the bottom so that it doesn't fall off, and maybe 2022 is the year we can take a look at it.
I think that's great, Dan. I am going to put home care aides. And do you mind actually, it could be via email, sending me the verbiage that you would like for me to add to the goals?
Sure.
The wording? Okay.
Yeah, thank you.
Sure. Are there any other comments for Office for the Aging? Amanda?
Well, mine is kind of a general comment for everyone. I mean, I guess I personally don't want to come up with like more things that we want to like tell the departments they have to do. So I guess my question to all of the department heads who are here is like, what can we do for you? Like, what is this? You know, obviously we have to pass resolutions and all of that kind of stuff, but you know, if there's anything that we can specifically work on or offer support with, that's what I want to do this year. So.
Yeah, and that's absolutely right, Amanda. And Henry and I went into the conversation of saying, you know, there's no reason for the committee goals to be going one way and your goals to be going the other way. We realize we're really in a time of crisis, and what are your goals? And so our goals really basically aligned with theirs. But department heads, if you notice that, you know, in making these goals, we were off base, or maybe we didn't interpret some of your goals correctly, let us know. We did try and follow your lead for all of the goals though. Okay, any other comment for Office for the Aging? I see no other hands. Thank you very much, Lisa, for meeting with us and taking the
Thank
time. Office of Human Rights, provide monthly presentations and outreach to our community that are time sensitive and educate the public. Continue to provide counseling and reporting for fair housing and non-discrimination in Tompkins County. Conduct a deep dive assessment of the number of human rights cases from Tompkins County being filed with the New York State Office of Human Rights to ascertain if Tompkins County should revisit the state with an MOU for limited case conciliation. Reverend Ken, how does that goal sound for you? Reverend Ken, I think you're on mute. I don't think it's my error this time. I don't think we can hear you still. No. Uh-oh. You know what we can do is we can skip over Office of Human Rights and go to another department, if that's all right. Okay, sounds good. Okay, next, Office for Veteran Services. Mr. J.R. Claiborne. Hello, J.R. And for your goal, we had continue promotion and outreach to veterans and help them through the pandemic. JR actually gave us 3 or 4 different goals, and we thought that this was all of his goals kind of led to helping veterans through the pandemic. So that in and of itself is a really, really big goal. JR, do you have any comment?
No, I was trying to think of if there's something more better to say, but I think you probably encased it there. Just know that I will be reaching out if and when that time comes for your assistance, and I appreciate that.
Okay, thank you very much. Are there any questions or comments from committee members? Okay, I see none. Thank you, JR, for meeting with us. And next is Youth Services. Kate Shanks Booth, welcome to HHS.
Hello.
And continue to provide municipal coordination of services so that they align with the results-based accountability goals. And just wanted to check in and see if there were any other goals you would like to add or any other comments.
So I think ultimately the goal is to be results-based accountability, but our goal, that's probably a year or 2 out. So we're helping them set goals right now and track those goals. So, but specifically around how to best meet the needs of the rural youth and just youth in general in the pandemic through the DEI lens and that sort of thing. So.
Okay. Rural youth. Okay, great. I'm going to make those changes.
Okay, thank you.
And then I am happy to send out a final draft to everyone once I have Dan's wording as well. And all the changes that we make today. Okay, are there any questions for Kate? I see none. Thank you, Kate.
Sure.
Department of Social Services, continue to provide services through COVID while training new workforce. Quarterly updates to be provided on eviction moratorium and Code Blue. Committee will follow effects of state and federal government decisions and how it will impact social services locally. Hi, Kit. How you doing?
Good. How are you, Shauna?
Good. How does that sound, Kit?
I think that's what it is what we are doing. And as I said to you and Henry when we met, I think that right now we are just seeing so many needs from the community based on what's happening with COVID, and so I think the greatest challenge, if you had asked me without COVID, what would be our goals for 2021, we probably would be looking at some additional goals about moving ahead with certain things. But I think right now, serving the community, preparing for when and if that, or not if, because it will be when that eviction moratorium goes away, which right now that date is set in May, but we know that could get extended. But I think that's the greatest challenge right now, and just getting staff up to speed that have transferred to us or have joined us during this time. We've had a number of retirements over the last year, which weren't completely a surprise, but I think were probably, a number of them were stepped up in their timing because of the crisis. So we've taken on some new staff. We've got some other people that we're bringing on now and getting everybody up to speed, so that we can continue to serve people, and if the crisis were to deepen at any point, that we could still address things. Those are our greatest goals. So
Great, thank you. Are there any questions or comments for Kit? Are there any questions or comments for this goal or anything that we would like to add? I don't see any hands. Thank you very much, Kit. Appreciate it.
sure.
And for public health, we don't have anyone from public health here, but I will definitely make sure Frank did receive the information. Continue to coordinate with providers to provide our community with testing, vaccination, and efficient contact tracing. Focus will continue to be on active communication to our constituents. Explore with relevant staff the feasibility and potential implementation of a mobile vaccine clinic that can be rolled out seamlessly for both flu and COVID vaccines. So those are two goals that we thought might be perfect for public health. Committee members, do you have any questions or comments? Anything we would like to see happen in our public health department? Okay, I see no hands or comments. Thank you. For mental health, hiring and onboarding new mental health staff and providing monthly updates on mental health services in the county. And they did just hire a new deputy director for mental health. I believe she's starting the middle of March. So she will be coming to our meetings and updating us more on mental health. We have not had a deputy director in that role for close to a year now. And we've missed having the updates, and it will be very, very nice to have Harmony join the team. She's actually been a member of the Community Services Mental Health Board for a few years now. She offered services, I believe, in Schuyler County. And so it's nice that she's had that dedication on the Community Services Mental Health Board locally. And she is going to be a wonderful asset for us. Are there any questions for mental health? Okay, I don't see any hands. Combined public health and mental health. Revisit and reevaluation of the public health and mental health joint department structure to ensure that individually and collectively each area gets the adequate resources and structure they need to provide continuous, excellent service to the community. Updates to be provided on a quarterly basis. So are there any questions? I see a thumbs up from Amanda. Any questions, comments, concerns? Okay, I don't see any. And Human Services Coalition, continue to support the community members through the pandemic through HSC navigators, workshops, and compassion and fatigue training. Hi, Kathy, how are you doing?
Good.
Good. Great. Are there any other goals you would like to add to our list? Did we do an all right job capturing your goals?
Right. A lot of it is around support to the agencies, both through training and to the community through 2-on-1. We do start internally with a DEI initiative, taking a good look at that, and then the rollout of our new grant for the anti-displacement grant. Those are kind of the three things we're focusing for, at least for the first part of. Who knows what the year will bring? Totally
Right.
different by the end of the year. So
Okay.
not a dull moment.
That's right. That's right. Are there any questions for Kathy? Are there any goals or comments that would like to be added? Okay, I see none. And additionally, we would like to work with Housing and Economic Development Committee to seek potential legislation to cap the amount of late fees landlords can charge renters, and only after 30 or 15 days of rent being late. And I actually, Leslyn had brought this to my attention, and I did reach out and talk to Jonathan about what the law is, and is this something locally we can do? He said that after 5 days, that they can add a late fee, and it is a certain percentage of the actual amount that's due that can be charged. That is decided on a state level. So I'm not sure this is actually going to be one of our active goals. I'm guessing that if we want that changed on the state level, we can contact Thomas O'Mara or Assemblywoman Anna Kellis to see if they would be willing to go forward with legislation and change that. So I expect that we can have some more conversation on that, because I know historically what's happened is that landlords fine people ridiculous amounts, and it ends up having people just get in the hole deeper and deeper and unable to recover. So I'm glad to hear that that changed in 2019. But I think we could probably do better as far as 5 days late is really not that long. And for landlords to be able to charge even 5% of the amount due is quite a lot of money for some people. So, and Reverend Ken, welcome back.
Okay, I think, can you hear me now?
We can.
Okay, wonderful. Okay, so if you could reread the goals, because there were a couple of things added to that were in addition to what I submitted to you.
Yeah.
Just so I can address those.
Sure. And we actually consulted with Jason as well as Leslyn, and so they did provide some feedback for your goals too.
Okay.
So we did add a little bit more. Provide monthly presentations and outreach to our community that are time sensitive and educate the public.
Mhm.
Continue to provide counseling and reporting for fair housing and non-discrimination in Tompkins County.
Mhm.
Conduct a deep dive assessment of the number of human rights cases for Tompkins County being filed with the New York State Office of Human Rights to ascertain if Tompkins County should revisit with the state on an MOU for limited case conciliation.
Okay. Okay. All right. Well, that I think certainly captures much of what we discussed in terms of the right now. I mean, in terms of where things stand, in terms of our numbers, whether they be inquiries or actual complaints filed. I mean, we're not at a point, I think, in which the state would consider sort of reestablishing the MOU at this juncture. I mean, right now we are getting somewhere between 25 to 40 inquiries a month, whereas this time a year ago we were getting anywhere between 100 to 120. And so we are going to be working with the commission to create a publicity campaign to encourage people to make inquiries and to know that the office continues to be a resource for the community in addressing their human rights concerns. We've been somewhat forestalled with that because we've had several people, including one of the persons who was in the chair of the communications committee, resign from the commission because of various other commitments, personal and professional. And so once we get a new committee chair for the communications and replenish the commission, we have a couple of new applications to consider now. We brought on one new commissioner, Peaches Gillette, and we have that leaves us with about 3, if I'm correct, vacancies to fill. Then we can kind of move along and see what we can do in terms of helping to encourage greater public interaction. Otherwise, I think things are pretty much consistent, and we have a program coming up next week, which I can mention during the departmental reports.
Great. Thank you, Reverend Ken.
Sure.
And
And
oh, go
if I
ahead.
could add one more thing, in terms of addressing Amanda's earlier question, I mean, I would encourage legislators to, to make their constituents aware of our office and that our office stands to support people in with regard to their concerns as they emerge. And I think that would be, and I know a number of legislators have done so, but that would be the one thing I would ask of, of the legislative body.
That's great. Thank you. I
Mhm.
have Amanda, Henry, and Martha.
Great, thanks. Thanks, Ken. I really like seeing on there an assessment of the number of cases that are going to the state. I feel like I haven't really heard anything about that in a while. I mean, there's been a lot else going on, but some more information about what our numbers are would be great. And then my other request would be to maybe have the chair of the commission come in and give us an update or a report, or how are they doing and what are they working on? I mean, we don't usually hear from them directly, but that would probably be nice.
Sure.
I think that's a great idea, Amanda. And maybe we can have that happen, twice a year, maybe in, June and then again in December.
Yeah,
Okay.
that I would love that. That'd be great.
I think that would be great too.
Okay.
Great. Thanks, Amanda. Henry and then Martha.
Yeah, thank you, Reverend Paul, for the update. Did you say that you had 3 open spots on the Human Rights Commission?
What's that?
Did you say that you had 3 open spots on the Human Rights Commission?
Yes, we've had I think a total of 5 vacancies from the original 15 who we reconstituted the commission with 2 years ago. Of course, Kirby Edmonds died, and we've had 4 other resignations. And so we are right now we're at, if my numbers are correct, I believe we're at 11. So we have 4 more to fill.
Okay, well, and are you guys actively working on filling those?
Yes, I mean, there are people who are submitting applications now. We've got 2 persons who have submitted applications for the commission within the week, and commissioners have been actively recruiting community members. In fact, that's how Peaches Gillette became a member through a referral from one of the commissioners. And there have been other commissioners as well who have been in touch with individuals, and that's reflected in the applications themselves.
Okay, thank you.
Mm-hmm.
So just a reminder too, Reverend Ken, that at one point, whenever we were reimagining the Human Rights Commission, we didn't know whether to go with 15 or 11 or 8 commissioners. And, I think the struggle 4 years ago was that we didn't have enough commissioners to present a quorum. And so they really couldn't do the business of the county. And not that I want to reduce the number of people that are on the Human Rights Commission, but I do want that to be an option just in case we aren't able to recruit enough people. I would hate for there to be a situation where we didn't have enough people for a quorum and the business of the county could not be discussed or voted on. So, feel free to, throw that out there. If there are plenty of people and we have people that are interested in those roles, and that's wonderful. And I hope that we can have 15 robust commissioners. But I also know the reality of everyone is very busy right now. Sometimes people don't come to meetings, and I don't want that commission to get to a point where they're not effective and not able to do the good work of the county.
Sure.
So that option is always there.
Okay, well, I appreciate that. I mean, I will definitely mention that to Gladys when we meet. And we'll keep that option open. I mean, our intention is to fill the slots.
Great.
If we find that difficult, we can always recalibrate.
Yeah, and at this point, it's the decision of the commission, and, you know, you guys can certainly make that decision on your own and figure out what's best, but I did want to remind you and give you that option.
Okay, thanks. Appreciate that.
Sure. Martha Robertson.
Yeah, I didn't have anything for Ken or human rights. I was going to go back to the landlord issue if you want to finish, if there's anything else on that.
Okay, yeah, are there any other questions for Reverend Ken, or did you have any other comments, Ken?
No, nothing else from me really. Now I got clarity about the piece with the MOU, so I think I'm good.
Okay, great, thank you.
Yep.
Okay, Martha, welcome to HHS.
Yeah, you bet. Thanks, Shauna. On the landlord late fee question, so I guess I'm not sure if is this a decision to go after this anyway and try to get a state law changed, or you just want to discuss it, or?
I think at this point, it's more of a discussion, because I'm not sure that how much this is really in our purview. And I'm not sure how much time and effort we want to put into it if we really can't make an impact. So I think we, you know, I'm certainly willing to research it and figure out what our options are, and we can have a discussion, but I'm not sure it's going to go anywhere.
Yeah, it's a big one. And I would assume if you got a local law passed, if we got a local law passed, enforcement would be a big question too.
Yeah.
Folks might be interested in that we have, I'm setting up the meeting for next week's HED meeting, and Kevin McLafferty from Law New York is going to come and talk about, the homeless and homeless prevention and housing work that they're doing. I specifically asked them to talk about the eviction moratorium and how it's going, and, you know, what are they seeing about impact on landlords too. So in case anybody's interested in that. And so just then you and I talked, I just want to mention that you and I talked about another issue that will wake up Kit over there. I wanted to revisit the idea of countywide code enforcement. This came up in a planning advisory board meeting by the town of Lansing, and Kathy Schlaughter has obviously had this on her list of policy issues as well. So I just want to let this committee know that I'm going to propose that as a goal for HED, and Sean and I kind of agreed that you know, these issues were things we would probably coordinate on. So just wanted to let you know.
Are there any questions for Martha? Okay, I see none.
All right, thank you.
Thank you. Okay, let's go ahead and go to the minutes approval, so that Dan can vote on that. If I could have a mover for the January 12th minutes, moved by Amanda, seconded by Dan Klein. And are there any questions or comments on the minutes for January 12th, 2021? I see no comments. All those in favor, let's do a roll call. Dan Klein?
Yes.
Amanda Champion?
Yes.
And Henry Granison?
Yes.
And I am a yes as well. That's 4 votes yes. Thank you. And let's do some departmental. Oh, I'm sorry, Henry, is that you?
No, sorry.
Okay, that's right. Let's do departmental updates. Why don't we start with Lisa Monroe from the Office of Aging?
My mouse just died. I couldn't unmute. I really don't have anything. I just was going to mention the workshop that we did today, and that we will have more information about the future ones coming up. And that we're just holding steady here, getting a lot of calls still about vaccines and whatnot, trying to help who we can. And that's about it.
Great, thank you very much.
You're welcome.
Kate Shanks Booth from Youth Services.
Yeah, just a couple of announcements. I'm happy to announce that Bridget Nugent, my deputy, is out on maternity leave. she gave birth to a little boy a couple days ago. So she's out doing great things. So we're excited for her. And in the same vein, we are going to be onboarding a new coordinator for community youth services next Monday. So we're excited about that. So that's what we're doing over here.
That's great. Congratulations to Bridget from all of us. How wonderful to have a new family member in this bizarre time. Okay, Kit Kephart from Department of Social Services.
Yes, so we are busy. That's what I can say. There's no shortage of work these days. We are providing supports for people for rent and expenses they've incurred during this COVID time through the ESG grant that we received. We are waiting. These are just a couple of program updates for people to know. We're expecting that we're going to be seeing a second HEAP benefit coming through for people. We haven't gotten word on that from the state yet, but we anticipate that any day now. We are, I won't bore you with the details. Usually I don't talk at all about audits with this group because we get them regularly and they're a bit of a hassle, but we are in the process of dealing with, I can honestly say in my 20 years at DSS, I've never seen an audit like we are dealing with in our child support division. This is a federal audit that is auditing the way we handle federal tax information. It's actually coming through the state, but it's a federal audit, and it is unbelievable. They've wanted to know everything from how are we handling the paper that we deal with around this, all the way to how is the building built, so that they want to know things like, could somebody theoretically scale the building with rappelling gear and come in a window and access records? I mean, it is comical on some level, but they really want to know this information. So we have literally been interviewing other department heads throughout the county and trying to gain information that I never thought we would need to gain. I'll be surprised. I keep joking with people that we're probably going to have to build a moat with alligators in order to really prove that we're keeping records secure. But seriously, the reason why I bring it up here is because I want people to know, I guess I want people to know the work that's going into it. But the other piece that I want people to be aware of is that it will not surprise me if we are going to have to make some structural changes. These are things, we are in compliance with everything that we have been asked to do in the past. But these are changes that are coming that we've never seen the likes of, and we know from colleagues in other districts that they have also had to make some significant changes. So more to come on that. Right now we were provided with a 45-page document. It is legal size, 45 pages, double-sided, that we have had to provide the answers to. But the next step is then that they will actually come out and do a physical audit and interview everybody and all of that. So lots of work going on around that, but more to come as changes are necessary. And then the other piece program-wise is that our children's services staff are in the process of going through signs of safety training. I think I've mentioned that here before, that signs of safety, we are one of 2 districts in the whole state that were asked by OCFS to participate in a new mode of handling cases called signs of safety. We're pretty excited about it. We're honored to be asked, but it's also going to really give us a new way to look at records. We just went through our association conference at the end of January. And I'm really pleased to say, so in the next budget cycle, the state is actually going to require all districts to start to use FAR, which is the Family Assessment Response Technique. We have been using that technique for about 10 years. So very little transition for us, if any, but it is, they are going to start requiring all districts to do that. And we are ahead of the game with that, and now getting SOS trained and really kind of using this new model. So we're pretty excited about how that's going to lead us into a new way of handling cases. And there's some legislative changes that are coming in the next year around CPS that I think we are going to be well poised to adjust to. So, so all of that's very long-winded, but I wanted people to kind of be aware of what's happening at the program level. Shauna, you had asked me, and I can be brief here, I know I've gone on a bit, for a Code Blue update. Where we are at with that right now, we're during the same time, so January or October to January, we've seen about 1,609 bed nights. So those are people that are utilizing beds each night during that period. Last year, during that same period, we were at about 1,255. So about 375, 380 less or more this year than last year. So we're up a little bit. Typically, we're seeing 40 to 45 people in our Code Blue program utilizing beds every night right now. It fluctuates quite a bit, so it can be a little higher, a little lower, but that's about kind of average about where we're at. There's not, you know, the question that I get asked all the time by the state and by others is, how is COVID affecting the Code Blue and other services? It's really difficult with Code Blue to really say definitely. What I will say is we are using less congregate placements these days because of the risk of COVID. So I think it probably has boosted up a little bit our numbers. But I can honestly say I am incredibly pleased with our St. John's shelter provider. We have only really had to nearly close. We haven't fully closed actually at any time, but we have had one period where we had to almost close for a couple of days and had to put people at other settings because we did have some COVID cases at the shelter. But otherwise, considering some of the other districts that have had to have their shelters closed for extended periods of time, we have really done well. And obviously that's reflective of our shelter provider. It's also really reflective of the hard work that's gone in this county to manage COVID. So, so that's kind of a not so brief update about where things are at with the SS.
Thank you, Kat. Martha?
Thank you. Some important stories there, Kit. This audit, did you say it started with the federal government?
So it's the federal tax information that staff access, some staff access in order to process child support cases. There are very, very strict regulations around that. For instance, you know, if you access any of that information, you have to not only have to document in a separate record that you access it, but then you destroyed any printed records of that. Very, very specific and rigid rules around that. So yes, it's coming from the federal government, but of course, because all of the child support program is under OTDA, it all comes through the state.
So I assume this was initiated before January 20th?
Yes, I don't know, honestly, Martha, what date we got. They have been working on this for several years, and we knew that something was coming. We had no idea it was going to be this extensive. But sure, I'm sure that we probably got it at some point, like sometime in January, but I don't know if it was before the 20th. I can check that out. Is there a significance there?
Well, it just sounds, so it basically came out of the last administration. So I guess where I'm going is, if this made me think of our earlier request about, are there any state issues from the Tiger Committee? Are there any state issues where department heads would be interested in having us lobby? And I know you sent back a very detailed list of things that were way above our pay grade. You know, we realized, okay, we certainly weren't able to talk or lobby about the very detailed kinds of regulatory issues you had raised. Now this one feels like, is this I'm just going to go there. Is this a punitive kind of a thing coming out of the federal government under the last administration? And is it anything that might be changeable?
I don't think so. Although I guess the proof will be once we actually complete the audit, and maybe what we will want to do is take a look at what they actually require of us. I mean, I think right now we don't have a great sense. It is my belief that this has actually been in the works for a long time, even potentially prior to the last administration. There are a lot of things that I think have been kind of on deck to be worked on in terms of increasing security around records, around cyber stuff, because I think what the big concern is as time goes on is that everything's hackable. Everything's, so I think, I don't know how much, and now obviously if they tell us we have to build a castle with a moat and alligators, then maybe we do, maybe I'll come back to you at that point and say, help, we have to take this to the state and lobby, but hopefully we won't go there. Hopefully this will be more of a, this will be something that's a little more reasonable and hopefully phased in, that they'll say this year you have to make this change and next year you have, so that's what I think.
Okay. All right, thanks. So just then a general invitation to all the department heads I see on my screen. If there are issues that like your state association or that you're seeing that you think really you'd like to see some, say, education with our state delegation or our federal delegation, please let us know, because Tiger could take on those kind of things. We are planning to meet with all of our 4 state representatives. And if you have anything that we should have on that list for those agendas, please let us know. Thanks for taking the time. Thanks.
Thanks, Martha. Okay, any other questions for Kit? I see none. Thank you very much, Kit.
Thank you.
J.R. Claiborne, Director of Veteran Services.
Hello again. Sure. Yes, well, of course, we're continuing to support our Warrior Writers Tompkins and our Veterans Coffee House sessions, which the latter is happening tomorrow morning at 7:30. It's our next one, and that's virtual. Also, last month, I helped support the Mental Health First Aid for Veterans and their Caregivers class. It was virtual. That actually ended up being a bit of an adventure because it was the first time that was done virtual, and there were a whole lot of moving parts. And have to say thanks to Ariel and ITS, because he came over and helped get us launched and pulled us out of a scary spot there for a bit. But we got that pulled off. She did, Beth Golden, who is a local therapist who's been conducting these courses. She had one planned for this month as well, but that one has had to be canceled. So there may be one next month. I've been encouraging her to look at different series, things that we can use as a series for our veterans community here. So I'll be letting you know, hopefully in the next couple of months, what our next thing is. Per your suggestions, committee last month, I helped Reverend Ken find a veteran for his panel, Is This Who We Are? And we had someone come down, Deb Howell, who she's in, I believe it's IT for the library system at Cornell, but she also heads up the VC&G listserv, Veterans Colleague Network Group at Cornell. And she brought a great perspective to the panel. On kind of a cool note, I got to be in company with Leslin and Henry, as well as Deanna, in doing the Tompkins Chambers Business After Hours event. It was last month. It was focused on Black History Month, so we got to be their spotlights for that, which was kind of cool. And then today actually I had a training this morning with the state Veteran Services. They did an overview of the Deborah Sampson Act, which is a new law that aims to fix and or create equitable access to healthcare, housing, legal services, and other resources and benefits for women's veterans. So there's a lot of attention that's coming from the national and state level for many of the issues for women, particularly for things dealing with military sexual trauma, with women's health, with prosthetics and mental health and childcare. And it looks like it's going to be a real comprehensive approach that's going to be undertaken. And all of this is to push the VA to make sure that they accommodate our women veterans. And for those of you who'd like to know more about this, there will be a lunch and learn over the noon hour, Thursday, the 25th. If you're interested, I can send you the link for that. But this, again, is going to be an overview and talking about changes with the Deborah Sampson Act. And I can tell you offline with this, but Deborah Sampson herself is someone that actually is someone worth noting. But I'll just say as a teaser that she is someone who signed up as a he for the Continental Army during the Revolutionary War, and she fought alongside the men. And the only way that they found out her gender was when she had to seek medical treatment for a fever. And unfortunately, she was kicked out soon after, honorably, but then she was denied pension benefits when she got sick, gravely ill, and was trying to get pension benefits. So just to leave that with you there. But again, that's going to be next Thursday, the 25th, over the noon hour. If anyone's interested, I can provide more information.
Great. Thank you very much, JR. Are there any questions for JR? I see none. Thank you. Reverend Clark, would you like to give us an update?
Sure. Yesterday, we finished our final session of the WDIC reading and discussion group, which was centered around Ibram X. Kendi's book, How to Be an Anti-Racist. We had really fantastic participation from 20 of our county colleagues in the book read, and it was really skillfully facilitated by Belisa Gonzalez from Ithaca College. And as we looked at four chapters in Kendi's book over the previous 4 weeks, we've gotten a lot of good feedback for this series, and I was very pleased with the way things turned out, and then the level of engagement of the staff members who were involved, the questions they asked, the level of probing and kind of wrestling with the realities of racism in society, and how, for instance, we take this knowledge and begin to implement this in creating and maintaining equitable environments in our respective workplaces. And so I thought it went very well. JR was one of our participants as well. And so that reading and discussion group worked out very well. And so I also too wanted to mention an upcoming program OHR is sponsoring with the county's public health department and with the Department of Health and Physical Ed at Ithaca College. And the name of the program is African Americans, the Death Gap in Health Equity, One Doctor's Perspective. We are inviting Dr. David Ansel, who is a senior vice president at Rush University Medical School, institution in Chicago, and someone who has worked for over 4 decades in some of the poorest neighborhoods in Chicago and in the hospitals that are in these neighborhoods. He's written an important book called The Death Gap, How Inequality Kills. And what he has done in this particular book is to really look at the ways in which racism and other types of inequality and structural violence are social determinants of health across the lifespan. And so he will be speaking on February 25th from noon to 1. He'll talk for about 25 or so minutes, and then we will take questions and answers from our online audience. I sent out a notice about the event this afternoon, which you should have in your mailboxes, email boxes, that is. And so that's our next program coming up. Also, I have been asked to work with a group of colleagues from human rights officers across the state and with the New York State Division of Human Rights as we begin to look at ways in which the state division and local offices can work together collaboratively. The state has made an intentional effort over the past year to engage local human rights offices on a regular basis. It's come up to approximately once a quarter in which we get a chance to interact with them. They provide some programming that informs us on certain human rights issues in the state and such. And so this work group will be taking a sharper focus in terms of what the nature of that interaction and partnership will look like, and in ways in which there can be collaboration in terms of programming, which our offices do, and enforcement, which the state division does, as serving in effect as the human rights police for the state. And finally, we're in the early phases of preparing for a search for a new education and outreach coordinator for the office. And I'm in process of rewriting the position description, and I'll be working with human resources to begin to get the ball rolling in terms of a search that will land us a person who will be our point person for education and outreach.
Great. Thank you, Reverend Ken. Are there any questions? Oops. I see none. Also, just to let everyone know, I think it is public now that the vaccinations that were supposed to happen Friday, unfortunately, will not be happening. The 1,100 doses are experiencing some delivery and travel issues. So the clinic up at the Old Sears location will not be having their vaccination clinic that day. The pop-up clinic at BJM will still host the 200 to 300 doses that they had scheduled. So I just wanted to let everyone know that was the emergency that Amy and Frank were attending to, but now it's public, so everyone knows. Let's see here. We have Kathy Schlatter from the Human Services Coalition.
Hi, not too much. Just want to let everybody know that 211 had their busiest week ever last week, and they just keep, each week tends to surpass the week before, which is great. And my other thing, it seems like everything is on the 25th, but in the morning of the 25th, we are kind of opening up our workshops again virtually, but we're having a workshop on how do you go back to work. There have been a lot of concerns, questions, whether you're saying, how do you get everyone back in the office? And so we are starting with a workshop on that from 9 to 11, and the information on that's on our website. I'll probably see it myself. So.
Great, thank you, Kathy. Are there any questions for Kathy? Okay, I see none. And I also say that we have a visitor, Mame Nadai. I've noticed that you joined Health and Human Services Committee, and I'm not sure if you wanted to add public comment or if you were just here for the pure entertainment. But we're happy to have you speak if you'd like to comment. Oh, I see that she mentioned in chat here. Hello. Okay. If there are there any questions or comments from committee members, legislators? Henry or Amanda? I see none. Well, thank everyone for attending. Oh, okay. So Mame is, she just wanted to add, she did not want to add public comment. I'm a graduate student at Cornell researching policies surrounding the vaccine. Well, thank you for doing your research, and thank you for joining our committee. You're welcome anytime. Henry has one last comment before we close out.
Yeah, Martha basically asked in the chat, do you know about the Titus Towels and McGraw House vaccines?
I think they are part of the cancellation. Okay. It is in the, we just got a press release a few seconds ago, though. I want to say they're canceled. Lisa, is that what it said?
yes, it won't be happening this week.
Okay. Oh, how frustrating. I know it's just a matter of waiting, another week for some people, but it is anxiety provoking. And I feel like, you get a little bit of light at the end of the tunnel, and then, something like horrific weather happens, and you have to wait a little bit longer. So, well, thank everyone for attending. Be well till the next meeting, and we'll see you later. Thank you.
Thanks, Shawna. Thanks, Brittany and Katrina.
Thank
Yeah,
you.
thank you.